Good evening, everyone. It is Thursday, March the 7th, and it's a happy spring day. We had a pretty good day today. Thank you all for coming. We're here at the Sumner County building, room 112, and this is the Opioid Abatement Committee. I would like to thank all of us for being here tonight. The invocation, would you like to?
Sure. God, we come before you humble and grateful to be in this room and have an opportunity to do this. And God, we're excited for what the next few months and years have in store for our county and also for this committee. God, I pray that you guide the discussion, not only tonight, but in every meeting to come, that steer us in a way that will have the maximum impact for our county and our residents here for this terrible crisis that we're facing. And God, that ultimately those people also can find their way to you. God, we love you. In Jesus' name we pray. Amen.
Amen. I'd like to say the pledge of
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I make approval of the agenda. Do I hear a motion?
Motion. Second.
Okay. All in favor? Say aye. Ready? We don't have the minutes ready yet, so we'll have them next week. And so we'll approve those next week. Okay? And recognition of the public, we don't have anyone here to be recognized. But I do appreciate those that are here for coming. So report of the chairman, I don't have anything. And then we're going into old business. And so our old business tonight is discussion of application and funds, in the parentheses for those that are watching online, getting a request from the organizations on process to apply. So I will yield my time to Dustin.
Okay, I'm going to walk you through the packet page by page. If you want to add anything, subtract anything, please let me know. Tonight I'm looking for approval to work with ITS. And in doing so, working with ITS, we will develop a prototype for next week's meeting for you all to apply, to approve, and to send to budgets, and then eventually send to the county commission. Also, next week is going to be a key item for us because we will have 2 policies in front of us. Those policies will allow you to know how we are going to be scoring the applications. Okay with that? Okay, and then on top of it, there's going to be also another portion for you all to look at as far as the policies that are being set up long term. So with that in mind, I'm seeking approval tonight for this to move forward with ITS so we can discuss it and have it finalized next week. Next week we're going to finalize the policies as well that will be overseeing this application, and then we'll move forward. So if you want to go ahead and open up.
Do you want me to copy? Yes, go ahead and do it.
Hey, can I ask a question? You mentioned next week.
Yeah.
I thought it was the 7th and 21st. 2 weeks from?
No, next week.
Oh, all right, the 14th. We'll change that.
Thank you.
I
thought
it was
7th,
Oh.
22nd. Okay.
I think it's because that's the week of spring break. It's 8.
Yes.
We know you all like to go to the beach. Okay.
Okay, so we're going to open up. You have the table of contents. No changes at this point in time to table of contents.
Okay.
Page 2, you're looking at general information. That tells you, this is strictly for the application for 2023-2024 fiscal year. We are asking to use the email address of scob@sumnercountytn.gov. For those that are wanting to apply, that will be the email address that you will be submitting the applications to. Next up, you have main criteria and funding. That lets you know that we are looking for the funds to be used for the citizens of Sumner County for awareness, education, and/or recovery for opioid abuse. Eligible agencies are permitted to submit 1 application per year to potentially receive a 12-month grant award, and applicants can only have 2 active grant contracts. After successfully completing one of the grants, they can submit another one. Also, we will be looking for proposals for funding annually. pending continued annual payouts from the opioid, from the state, national settlements, and at this point in time, there is no cost match for this funding opportunity, okay? At this point in time, if you look at timeline of submission and awards for 2024, that is changing and evolving and will be addressed at the next session. The reason being, I am meeting with David and Beth to discuss how this is going to impact the budget process. We want to make sure that the funding is actually in the budget process and that the applications and everything will match up with how the budget is hopefully going to be passed for FY25. Next page, page 3, you have the standard language stating the state law regarding appropriations and how we are able to appropriate said funds. Next is to report fraud, waste, and abuse. You have the suspected fraud hotline and how to report it to the comptroller as well as the U.S. Treasury. Both of those are standard language and was in the initial application that you all had looked at beforehand. Page 4, instructions. Instructions are stating that all requests must be submitted by email to scob@sumnercounty.tn.gov. Looking at it, you have belowhand, if you're not a civic, if you're a nonprofit charitable organization or nonprofit civic organization, you must submit the following: a completed funding request application, which is in this document, the state annual reporting form or copy of the agency's annual audit, your budget and actual financial information in the format requested below, a detailed salary schedule. If they want to explain more than what the space is allowed, they can actually submit it in a Word document to us. An implementation of the work plan, letters of support from collaborators and partners, and the monitoring form, the compliance survey. You also have, if you're a nonprofit civic organization, you must submit documentation that proves the IRS recognizes you as a nonprofit organization. If you are a financial information, or if you have financial information that is requested from a calendar year agency, you have to provide the budgeted revenue and expenditures for prior calendar year, the actuals for the prior calendar year, the budgeted revenue and expenditures for the current fiscal year. You have to list the funding sources and give a detailed breakdown, whether it's from the city, county, grants, program fees, private donations. When listing uses of funds, you have to give a detailed breakdown as well and provide an adequate description. If your agency pays for salaries, you must attach a salary schedule detailing job name, job title, and dollar amount, and your beginning cash balances for the years that are identified and above. Any questions so far?
I
Okay,
apologize, I wasn't at the last meeting.
You're fine.
Do we have anything that's requiring them to send letters of financial standing, like they're in good standing? And then my intent for that is to keep somebody from flying in, oh, we're going to be this 501c3, get a little money, and then they fly back out.
If you want to add that, we can gladly
I
add
would
that.
like to see something of that, showing that they're, and I don't know what the wording would be, financial standing, something showing that there's some stability, or I think that would prevent a lot of.
It would be like you would have to have, like say aggregate from before, like a year before, or 6 months, you know.
Okay.
Not just, I set this up last week and I'm ready to roll.
So I will address that when I meet with David and Beth tomorrow about the dates. I will address that as well, and we will put it in there for you under page 4.
One other question, Jeff.
Yes.
Are these only nonprofits, charitable organizations in Sumner County?
No, they have to serve Sumner County.
Serve Sumner County.
So if we'll just say Wilson County has an agency and they're looking at expanding to Sumner County and they want to serve Sumner County residents, then the money has to go towards Sumner County residents. It cannot be directed towards it. What you'll find later on in the application process, it's going to state how many residents in Sumner County are going to be served. And if somebody decides they just want to serve a city, and we'll just say it's Portland, then they have to say how many residents of Sumner County will be served. But we will get to that in a moment, but yes. Any additional questions?
Do we have anything also that's going to require their
financial statements for the last 2 years. And the reason why I'm thinking of this is because I process grants at Ball State.
Okay,
So when we do that, we have to show our annual reports, financial reports, something, showing that, hey, this is where, we're in good standing here, this is where our money out was allocated last year.
No.
This is our intent for
this is all you're asking for. So if you want to add for 2 years, we can add 2 years as well for financial reports that this body
I'm
wants
only one on the
it.
committee, but I think
Well,
that,
so, I understand what he's saying, but so, maybe devil's advocate.
Okay,
You got a group that has started, they're only a year into it, they're doing great work, and they wanna be part of it. They're only gonna have a year worth of data, so would that exclude them? So what, should we say a year?
I mean, right now you're asking for a year already of their budget and their expenditures.
Right.
And then you're also asking, I believe, for the audit, so you would have that as well.
Yeah. I'm afraid you might,
I wonder if you could put on there something like just a generic statement, like be open to
I mean, if you know
further
that,
requests, like
maybe,
maybe if it's a large request and there's some.
Or it's questionable.
And that we don't know any of their work, and it's a very, large request of that money, you can say, you've got a fallback to say, hey, can we get another year too?
Are you wanting to set a threshold? And saying that if the award is more than, we'll just say 10% of the aggregate that we are offering, you need to supply 2 years worth of data.
That's
that's
I like that.
probably good.
Yeah, I like
Okay.
that.
What percentage would you like to go for?
Jeez, we don't, if it's not clear to us, then I would, and we're this concerned, perhaps 10%,
Okay,
maybe even 20%. 20%, let's do 20.
okay, 20%.
But I would also put in there, like.
Because you were on the right track.
Derek was saying, if there are questions or additional information may be required on the application process. You know what I mean?
Okay.
and do we have any W-9 requirements for any and all, whether they're profit or not-profit?
Give me 1 second, let me go look at mine. You are asking for their federal ID number. That is on page 6.
And they'll have to have that to be nonprofit, right?
Well, it's,
Federal, any
Anybody.
501c3 letter.
I want to say no.
I would like that. I'd like to see the W-9 too, and the reason why, I'm not trying to cut out or weed out, I just want to make sure what we're funding is solid. It's not somebody that has heard of this and 6 months ago they filed with the IRS to get their number, and now here they come in, they get 200,000 and they're gone.
Tax, is it be the tax ID?
Okay.
Well, it's a W-9 form from the IRS though that shows who they are, what they serve and all that. It's an actual,
Well, you would need the tax ID and the W-9.
well, the EIN is the tax.
That's on the actual
Yeah.
W-9, I believe.
Yeah.
Okay, so right now,
All these nonprofit organizations have like filings with the IRS for like, they're all online, you can find them online, they're searchable. That could be a tool for you guys to use as well.
Right.
so right now, what I have heard is the following. We're asking for letters of financial standing, number 1. Number 2, if they're asking for more than 20% of the aggregate that we are offering to the county, they need to supply at least 2 years of financial history for us. And you're also asking for a W-9 form. Okay?
Now, let me ask this too, because I know with like some of our USDA grants and stuff, they want us to have a minority form that's in there. Is that required
We
as
have,
well?
it is not required, but we do have later on a form that asks the breakdown of the staff.
Are you talking about a DEI?
Yes. So if you look on page 11, you have the compliance survey. You actually have the organizational information and you have the numbers of each category to meet Title VI.
That's good.
Okay.
All right, that's okay, I think.
So we've gone through page 4, so we now turn to page 5. information in case it is ran on a fiscal year. We're asking for budgeted revenue and expenditures for current fiscal year, additional revenue and expenses for the current fiscal year, as well as listing the sources of their budgets where they get revenue, breakdown of their current listing of funds, as well as if your agency pays salaries, it's the same as the other one, except for we're asking for the beginning cash balances should be disclosed for both years identified in item 1 above. But based upon the prior conversation, would you like to add the 3 that we've added to that section as well?
Yeah, that'd be great.
Okay.
Everybody agree?
Yeah, simply is better, yeah.
I'm sorry, I'm not very good with the Robert's Rules of Order.
We can just suspend the rules and keep it going.
Let's suspend the
I
rules.
mean, I get the impression that you're also gonna vote on this as one big
Yeah,
thing
one-
anyway.
with
so-
amended
Do I hear a
yeah.
motion to suspend the rules
Somebody.
and talk freely? Thank you.
Okay, page 6, we're asking for the legal name of the organization. We're asking for the type of organization. Is it charitable, civic, or governmental? Federal ID number. The purpose of the organization. Will 100% of the funds provided be used directly for a resident or the residents of Sumner County, yes or no? The address of the organization.
Let me ask you a question
Yes.
before you go further. So I'm, 501c Charlie, and I come down here and I go, no. And so in your algorithm, it'll go to the back of the page, you're done.
Okay,
Because they're supposed to be Sumner County.
right.
There's no sense in filling out anything more if you're not gonna do Sumner County residents.
Well, let me ask you this though, what if it's White House, part of it's in Robertson and Sumner?
So it can only be Sumner, so I'll help you understand that portion. If you,
We talked about that.
yeah, if you go to page 7 and 8,
Yeah.
the way the state has let it out, and we do not have jurisdiction over this part, we can only assist the people of Sumner County. So if you're looking at page 8 specifically, and you're looking at Goodlettsville, Portland, or Millersville,
Okay.
it says
Yes.
how many in Sumner County, because those are the ones that we have to fund.
Right. So, but my question on that statement, you go back, because I was,
No need to fill in.
Yeah.
it's no issue now.
Okay. That would be
I'm just
added.
realistic, hey?
Could you, if we added a question that said year established, would that take care of what you were talking about earlier?
I would still want to see the documents to show, but yeah, it would,
You want to trust yet verify.
yeah,
That's what I've just heard.
yeah.
Okay. So I will add that as well, you're established.
Also, can we, under general information, I reading quickly here, the criteria is for Sumner County citizens, so on the statement here, you need to say refer back to page 2
Okay.
to help them understand why, if they choose to render it going on.
To page 2, main criteria.
Yeah.
Okay.
Yeah, just give them a reference.
So next, 5 is the address.
Would that be physical address?
Yes, I will put the word physical in front of it. List the current board of directors and officers, if applicable. The main contact person, their title, phone number, mailing address, email address. 8, the amount of funds being requested. What is the program budget for this request? So in case they have additional funds they want to put towards it, we will have a full scope of what the actual amount is for the program. The type of service, so they can select the ones that they want. How many paid staff members do you have, full-time and part-time? The amount of funds received from Sumner County in the current budget and the purpose. State if your organization operates on a calendar year or fiscal year, so that goes back just to double check the earlier one. So you'll see a lot of checks and balances here. If your board of directors approves the annual budget and review regular budget, do they review the regular financial report? How many people are being served by your organization? Percentage for the county as well as the percentage for each city. List the remediation strategy and the section number being used. And that goes back to the long state documents that lists out every single one. So they're gonna have to pick that one out. Now here's the key for 16. 16 is your key reporter. So on twice a year, we're gonna have to report back to the state. And we're gonna have to report back, what the remediation was and how many people have been served. So that's gonna be one key item for us all to be looking at.
Because that is attached to the amount of money you're gonna get.
Yes.
Yeah.
17 is please mark all of the objectives and service populations for your application and addresses, so you can actually see that. 17 should tie into 16. Is your agency certified, licensed, or accredited by the state of Tennessee? That's where we say yes or no proof, so that goes back to the earlier questions that we were having.
So if they're no, then
If it is no, if your agency is certified, licensed, and or accredited by the state of Tennessee, it's yes or no. A no could result in a department that the county runs that may not be recognized as an elected official. So it's a county-run department that may need access to the funds that may be applying.
okay.
That's where a no would come into effect.
Okay. For like, maybe, like, the, I don't know, give me a name of the department.
We'll play fictitious because this will come about here in a second. If a new department or an agency or a partnership was developed to use the funds to run a facility, then that would be a no.
Okay.
If you're an agency providing direct care or treatment of opioid use disorders, please list the evidence-based practices utilized by your agency. 20. Provide current strategies, tools, and mechanisms your organization will use to show the outcomes and success of your program using the funds provided by this request. 21. Will you be able to provide and present quarterly reports that should be reports from data of funding to include measurements of success to the committee? Is this information on the implementation work plan?
Just to kind of tie it all back together, should we say provide? Don't ask if you're going to be able to, because we're asking kind of for the financial statements anyway.
So this goes back to performance metrics. So basically, if an applicant wants to come in and apply for a program, and that program says we intend to serve 100 clients, and we're in the second quarter and they have not even hit 50%, they have to respond back to me on a quarterly basis to give me that data.
Give you that, okay.
Because
You might consider splitting that into two.
That's what I was thinking, 2 parts. It's kind of heavy.
2 parts. Okay. Two parts.
Two questions, yeah.
Okay.
Can I ask a dumb question?
There's no dumb questions, trust me.
So I've got who's applying, how much they're applying,
Yes.
what the total, how much is, what category it fits in, but there's nowhere in here that says, like, tell me what you're doing with this.
Let's keep on
Scope
going.
of work.
Okay.
We'll keep on going. We'll come back to that in a second.
Okay.
Because that should be answered somewhat on this portion that I hope you'll see.
Okay.
And if you want a section that clearly states scope of work, we'll gladly add it. That's not a
Okay.
problem.
I'll wait. I just wanted to make sure, because
Okay.
I don't deal in opioids so some of this, I need like a quick,
Quick.
tell
Okay.
me what you're doing.
We'll probably end up adding it because you want a quick glance at it, which is great. 22, are you attaching letters of support from project partners or collaborators, or if it's applicable to the program? How long will the program continue in the future without relying on the opioid settlement? So we all know in 18 years, the funds are going to run dry. It could be beforehand, it could be at 18 years. So we want to know, will the program continue? And 24, to assist this board and myself, we want to know if they intend on applying for the next 4 years and how much they want to ask for the next 4 years. Next, what David has mentioned, if you look at this page, This page, he would like to be added under the certification. And basically, it says that they have to report everything on a quarterly basis to us. It is a reimbursement program, so we will reimburse the applicants, number one. Number two, they have to give us the performance metrics on a quarterly basis. If they are not meeting the performance metrics, then they have to submit a corrective action plan within the first 2 weeks of the new quarter. Okay? And if for some reason they decide not to submit metrics at all, we do have the right to end the program, number one. And number two, they're not going to be allowed to apply for at least 2 years. That is the section that he would like to add.
It keeps everybody honest, it keeps
Two
everybody
things.
on track.
Yes.
On that, one, there's a typo in that second paragraph. It should say once the metrics have been received, not one.
Thank you.
Thing two, it's, the way I read this is they have to spend the money and then ask for reimbursement.
Yes. So for most grants, it is a reimbursement grant.
Is
So-
that-
Unfortunately, yes, it's standard.
It's been 76,000 at Ball State and then turn around.
Well, but I guess my question is when you're not
It's
dealing with
PO.
somebody like Fall State, you're dealing with Sumner County CASA that doesn't have $1 million or the court system, you know, whatever that is, recovery court.
Would a PO work though? Because sometimes that's the way we look around. We can show we've got a PO and we're budgeted for that much money. And then once the services are rendered, net 30 or whatever, then they come back and.
That would be fine.
Is the concern giving the money up front and then not getting the services and it's a waste?
That is one of the concerns that we have,
Okay.
because this is a new program. And anybody can ask for the full dollar amounts,
Right.
and then we would be stuck.
If they're doing a quarterly implementation work plan and turning that in, will reimbursement of funds come quarterly, or will that be at the end of the fiscal year?
Quarterly.
Quarterly.
So
Okay,
reimbursement
that's
of funds comes quarterly if they ask for it.
Yeah.
They have to give me the performance metrics, number one, but if they submit the performance metrics with a request for funds, then yes, we would release those funds on a quarterly basis.
That's a lot better than at the end of their.
Yeah,
Yeah.
so if your
Program.
group is, like you, Sakasa, we'll just use it for example, they wanted to get, say, $200,000, and divide that into quarters, then for the first quarter, you know, they got I mean, I don't know, they have some money there that they're working anyway, and then they show in that quarter that they've done all this, and then they get that money, and then they go to the next quarter. Because if you
We
put all the
suspend
money up
For a
front,
second.
you're always suspended.
Okay, we're already. Did that cause issue for any of you guys? Like, to be honest?
Reimbursement, correct?
Okay, I just want to make sure.
We
And that may be in my world, like, I'm in the lending world, so like, I'm not gonna say like, go buy a house and I'll give you the money back. Like, that's not how it works. So I just want to make sure if you're asking for big money.
It's
pretty standard.
That's, yeah,
Okay.
that's what we do now.
Okay, I just want to make sure.
That's why they eat bologna and then they get.
Yeah.
I just want to make sure that
It's
they're
every
trying to.
day.
Yes, you do, Tracy.
I don't want to, I
We have
don't
to
want
remember,
to.
they're
Maybe
not,
grilled bologna, but you can stay.
it's not just them.
Yeah.
Right.
No, I know, but I think, I guess what I'm trying to get at is I don't want it to cut them out and it only be some multi-million-dollar corporation
Oh, no,
that
no.
has the funds to do this, so.
I
I'm
don't
just trying to
see
think of
that.
everybody.
I really don't see that. I think that, you know, most of the people that are gonna be applying are gonna be already established and have a good base. Because they have to provide financials and all that before they ever get the
Sure,
money.
sure.
So they're gonna see that and they're gonna go, oh, you're negative 50,000 in your bank account. Well, yeah, no.
No, but
Well, they're waiting on those next 30 days to get the draw from.
I also don't want
Yeah.
to cut out a big dream, I guess, is
Right.
part of my concern too. Like if they're operating on a $200,000 budget and then they're asking for $1 million project, like, and then they think, well, I can't do that because I don't have a budget to support that for the reimbursement, so.
We don't have that much money.
Well, the quarterly reimbursement
Mike.
should take care of that, and make sure everybody's doing what you're supposed to be doing and turning their
Sorry.
reports. And they get
My
their money.
property.
No, you're not.
Performance metrics are great because they do keep everybody on track and
Sure,
honest.
yeah, absolutely. Sorry, Justin.
Oh, you're fine.
Like I
Okay.
said, I want these meetings to be really conversational so that we can get through this easily and get, because you think better when you're not like making all that. Sorry, I'm just saying.
Speaking of speak for you.
Okay, page 10 is the salary schedule. Page 10 can be substituted if they have a report that has everybody's name and everything. No reason for them to go through and just redo it all. Page 11, that's when we look to see people that they serve, demographics. Page 12 and page 13 is a checklist to make sure that they are submitting everything. Now there's two areas and one of them did not make it on here, but we'll address that in a second. Because I put it into another scope, which is in the policy. Okay. And it needs to be in the application. Now, if you go to the implementation work plan, which is the long sheets, you can see the table. The table asks for the organization's name, their VIN number. Oh.
Thank you, I'm sorry.
You're welcome. And I may be out, so I may have to give you one afterwards because I need one to walk them through. Looking at it, you're asking for the organization's agency's name, their federal ID number, the project budgets that they've requested, and the requested grant amounts. If you look at list of objectives.
You can have mine.
I got another one.
It lists the objectives of everything that they are planning on doing, what the course of action is to meet their objectives, the time frame for it, who is responsible in their agency, the financial portion or the use of the opioid budget that will be going towards this objective, the financial projection, the proposed measures of success, and the outcomes. Now, are you sure? Because I don't mind adding a paragraph.
This is exactly what I was looking for.
Okay. Now, the one area that is in the policy that I'm working on that you'll see next week that is not in the application and that is not on this page that I'm asking you to entertain now is, would they be willing to accept partial funding? Because we're going to run out of money at some point in time. So whoever is on that line list, they may not get full funding. So they may get partial funding. At this part in time, are you all okay with me adding, will you accept partial funding?
I think so, because, the money is kind of, as we know, is kind of fluctuating back and forth. If somebody goes bankrupt, then you forget it. That's happening,
So I will add a question that says, will you accept partial funding and the ability to change your metrics should you accept partial funding? Because it's not fair to hold them to the full metrics when they accept partial funding. Okay. So that is the application. That is the implementation of the work plan. Any questions at this point in time?
Do y'all have any questions?
I don't.
Are you going to adopt this now or next week?
I am seeking a motion to work with ITS to accept the proposed changes that you all have mentioned during our discussion, to come up with a website for them to look at, to disperse to you all privately, because I do not have the ability to give the public access at this point in time, to look at the online and us to come back next week and accept yes or no the full document with the changes.
Do I hear a motion to move this forward?
Second.
All in favor?
Aye.
There you go.
Thank you all.
I'm sorry.
Okay, we got more, hang on. Go ahead. So we're going to new business, right?
Yes, please.
We're all getting along.
Easy.
New business, so preparation of grant application outreach.
So when the dates have been finalized and we're coming back next week, we are looking at roughly advertising when the time gets closer on Facebook, our website. So when you land on sumnercountykn.gov, the first thing you're going to see is at the top a banner that says we are now accepting applications. We're looking at doing a press release, putting it into the paper, and I have been asked to figure out who actually runs our Twitter/X account and if we can put it on there. At this point in time, are there any other areas you all would like to advertise that have not been mentioned?
Can we do it on radio?
Radio. Yeah.
Radio?
We do it on both. Radio won't cost you a dime.
Did y'all want to put it in the paper, or did you already say that?
I think
It is in the paper.
Yeah.
Your boss has told me I had to put it in paper
Yeah.
and to make sure.
Does anybody read the paper?
I do.
I do,
do.
I still read it.
I like to read it and all, but I get it in.
Okay, anybody that not retired. Let me ask that.
I get it from the UT Ag building, because it's free, and I read the paper there. I'm cheap.
Is there anybody anywhere else
I
that
do.
would be like appropriate?
Read the paper, yeah. I do.
To like, I didn't know if there was like a drug grants R Us website. Like, I don't know. I just don't want to miss, like, you're like, oh. this is
Mental
the-
health, isn't there a mental health, mental health,
Tennessee Department of Mental Health and Substance Abuse Services.
yeah, that needs to go on there.
Yeah.
Or what about the
that.
health department, something there, I mean, I don't know, is it, no, that would be more, no, never mind. Organizations.
That's the
I mean, I get we're not
spot
gonna get
Yeah.
everybody, but I don't wanna miss like a spot. And it'd be like, well, I never knew about it, I would've.
So, yeah, I like, yeah, the mental health, Tennessee mental health.
I
Isn't it
will,
already on there? Sorry, that's.
I will inquire about Tennessee mental health. You will find out in a few that there's going to be an ongoing discussion with Tennessee mental health that I need your approval on, so we will conquer that in section C if that's okay with you all.
Okay. All right, are we done with A?
Anybody have any more
Any
questions?
questions on A? We'll move forward to B, discussion of calendar year meeting. We have a meeting next week, same time, same place. And then our information goes to budget. Am I correct?
That's questionable.
Oh,
At this point in time, yes, we do have a meeting on the 14th.
uh-huh.
Out of that meeting for the 14th, you are going to get a set of calendar year meeting dates that will be worked between David, Beth, and myself to make sure that we hit the targets for the budget year since we are running very close to
Okay.
it. In doing so, I'm asking you all to temporarily hold the 28th
What month?
of March.
March 28th?
Yes. We are, let me look at my notes real fast. If everything aligns the way that we are anticipating for tomorrow's conversation, we are looking at the 28th and then looking at the 8th and the 15th of April. That would go between the Budget Commission on the 8th and the County Commission on the 15th, with us reconvening on the 18th.
So it's on a Monday,
So we are looking at Thursday, the 28th for us.
I mean, the 15th, April 15th, it's a Monday.
The 15th is the County Commission, and that's when we're hoping everything will escalate. Should everything go on the way that we're anticipating, with you all meeting on the 28th, the 14th and the 28th, then hopefully it will go on the 8th and the 15th.
So, but this committee won't meet again until April the 18th.
We are meeting March 14th,
Right.
the 28th, and possibility of April 18th.
Okay.
Now,
Correct.
at
April
that
8th,
point, once
yes.
it starts rolling, Dustin, it should be a monthly thing, not 3 times a month.
Quarterly, I think.
Quarterly is what the goal is.
Well, I mean, you know.
Right now, our game plan is to get everything in place, lay the foundation, hopefully to have applicants hit at the end of April, beginning of May, contingent upon what the county commission has said. And then if that happens, we will start hopefully in July quarterly.
Yeah.
That's our goal. Our goal is not to meet every month. Once the applicants or the grantees receive their information, you're going to get notification from me saying I want to go over financials with you all, and I also, if I receive money from the state, which I'm waiting on additional funds to do that as well.
The only thing I'd like to ask though is, once we start this, we may have some little bugs show up.
Yes.
So we may need to meet prior to the quarterly thing, so I wouldn't stretch it too far. I know you all,
No, I'm just saying, once we get going, I think we're doing the hard work, I think, now over the next few months.
Yeah.
Just setting expectations.
we'll meet on the 18th, and then maybe perhaps we can set a date for the next time if we need to address some other issues further.
Just want to move just to old business then?
So, yes.
Okay.
So right now, we're looking at the 14th, 28th of March, and April 18th.
Do you know the current balance in that account right now?
We're going over that in the next section, yes.
I'll shut up.
No, you're good, you're good. You're keeping me on track, you're good.
I'm just put you in order. Okay, we ready to move on to C?
If you all are ready.
So we're gonna, number C is update from grant account.
Okay, so the update, this is going to cause us all heartburn because I'm going to have to walk back a statement I made last time. The statement that I made last time is I'd like to reserve 20% of our funds. Right now, we have $901,622.77. Okay, I asked for 20%. I am walking back that statement. The state of Tennessee has reached out to me, and I am asking for a vote on that one as well, and have given me the ability and information to apply for additional grants from the U.S. Department of Justice, as well as maybe 2 potential grants with the state. In doing so, there is a small project that's been on the side that we have discussed, and that is called a one-stop shop. The VA Health Department have been notified and asked if they were willing to participate. I have reached out to Judge Planton to set up a meeting to discuss this as well, to see if he's going to want to be a partner as well. In doing so, if we hold back $500,000, which is $500,000, we could potentially get anywhere from $500,000 to $1.5 million. But that's if the stars align. And if that $1.5 million happens, then we can release additional funds next cycle to the general public. But it is a one-stop shop, which will be addressed at the next meeting. Because I need.
Sorry.
Go ahead, ask.
A one-stop shop.
So a one-stop shop is an area that is not near the police department. It's not near the courts. It is not near any agencies that may have an interest in somebody that is using drugs. And so a person that is using, or a family member, can go to the one-stop shop, talk to a medical professional, a peer, or maybe somebody from the VA, to ask what their options are. That way it's not a rehab facility. It is not somebody connected to drug courts that has that information. It's somebody who has gone through the system. It is somebody that's there for the general public to disperse that information. It would also provide the locations of all the Narcan throughout Sumner County, and a few other caveats that will be there, such as working with maybe an opioid committee, not this commission, a committee being the elected officials that actually have a stake in it, to say this is where we're going, here's our federal dollars that we're getting, hopefully from these grant applications that are going to be submitted out. Should you give me permission to seek that? And then we'll generate more revenue for the longer term. It's a hard pill to swallow because we are taking $500,000 out, but we're putting in the necessary infrastructure for 18 years or longer so we can generate more revenue and longer lasting programs. That is the hardest pill for everybody to swallow.
So take half the money now to get a potential 3 times that.
Yes.
In the future.
And you
Is that the way I hear it?
gain interest during the time you're doing
Yeah.
But it would cut what we've got available now for
Temporarily.
the first year.
For the
right?
first year for the nonprofits. Right now, looking at it, when I talked to the health department, and I'm talking again tomorrow, there is an area by the health department, or another area that they're looking at with the health department in another location to do this. It would involve that $500,000 would be the seed money to hire 1 to 3 people.
Why would it not be at the health department? This sounds like a rabbit hole I don't like.
So the reason why it won't be at the health department is because it could be a conflict of interest with the health department. They would be a vested stakeholder. The reason why the one-stop shop is there, since you're with grants and you're familiar with sometimes the partnerships are the best way to go to get
Sure.
a grant. It would be a partnership with those 3 entities with a stakeholder in it. So that's why it's not necessarily with the health department, number 1.
They're stakeholders.
So they are a stakeholder. They would have buy-in on it. They would be responsible for a portion, just like the VA, just like the courts would. But it would be standalone, so that way all 3 entities, when I go to the federal government, would have it. or if I go to the state, we can say these three entities are working together. We would like additional $500,000. That's the way that I talked to Trevor as well as his boss have agreed and liked it. Mary was also on the phone call. So
And I see people, I know people think that, we're waiting for this money and we're ready to go. But long-term here, we need to be able, I want the people that apply to succeed and have the money.
Sure.
But if we have, in the treatment world that I've treated patients too. So one of the biggest things is a place where they can go without,
Judgment.
yeah, see,
Judgment
drug
free.
court, I like drug court, I think it's a great program. The only thing is it's drug court, it's because you got there because you abused. So I wanna catch you before you get to that situation where you get your information. If we just look at people that are coming into the court system, then we're missing the big population sitting over here, and they're doing users. They haven't got arrested yet, but they need help, and they don't know where to go, it's a dignity issue.
The third group of those people, though, are the ones that do get incarcerated, or they go through the court system, they're on probation. They need something so that they're not a repeat offender and don't make the same mistake,
Right. Well,
That's-
and I
that's the
think the
third.
drug.
that was one of the aspects the Veterans Affairs has stated is if they have somebody that is a vet and is coming out,
Yeah.
they would like to have an advocate, because if they don't, what happens, because they don't feel comfortable going to the courts and I violated my probation, I violated X, Y, and Z, they need somewhere neutral to go.
Yeah, so
Well, I don't think they really have a choice.
Well, what about the Project Lifeline?
This already
Yeah,
exists at the
that's-
state
yeah.
level at Project Lifeline.
Project Lifeline.
And that's why I said I didn't like this, because this is there.
But I
But
can't,
who's the
where
doctor?
is it at?
It's there. I mean,
There's a
you can reach out.
Project Lifeline coordinator for each region of the state.
Yeah.
That person is a liaison with mental health services, with treatment
Do
services.
they have an office where the person can go right to that?
Or we can create it. Yeah.
It's a referral, yeah.
We can create it.
They do. They're generally out of an office within that region. Like our project coordinator, our Lifeline coordinator for this region is Lydia Price. That's what she does. She gets people to treatment that do not go through the court system. But yeah, that is a state contracted grant.
but if I have a state contracted
I agree, the public
grant,
needs to be more aware
Hang
that
on a
that
minute.
exists.
Yeah,
if,
hang on.
if the state's involved, then I don't have a way to get the federal funds.
So that was where I was, so understand that it can't go to the health department. So I guess I'm confused. Who's the doctor?
It would be a clinic that all three agencies agree. It would be the partnership
Agencies
between the
being
three.
who?
Health, VA, drug court. And then also, this person would bring in together the public defender, district attorney, and everybody else to look at hotspots within Sumner County and to serve Sumner County.
So, but you're saying they have to be separate from the court?
I'm asking for the courts to be there strictly because there's going to be a component there, long-term. There's a program called Warm Hands. And so basically, EMS has said, Chief Post has said, if they get an opioid call, they have to take it directly to a hospital. Last year, at this point in time, at the end of January, there were roughly 288 calls, I think. I have to go back and look. Out of those 288 calls, half of those went to Sumner Regional. So what they would want to do is try to put somebody nearby to go in and intervene and try to get them to go to a facility and all of that.
They
But
need
I guess,
detox.
yeah. So I guess my question is though, to get 500,000, who's gonna be the provider? And why is the courts already involved with the DA and the public defender? Because my understanding is, these are people we're trying to intervene with before the courts get there.
Right.
So I don't think, and I'm just,
So to help answer that one, the courts would be there to, A, make sure that if a person wanted to go to rehab and do everything to meet that part, that A, there's not any major felonies that have occurred.
I don't think the courts can, and I may be out of step, but I don't think a court can do that.
So looking at
they don't have anything
other
to bring
grants
them
for
before.
this program, and I'll bring some to you, because Metro Legal shared it with me last time. If you're looking at Mountain City in that area, the Warm Hands program has worked with other departments to make sure that that person would not necessarily go in front of the courts until after rehab is done.
Then what brings them in front of the courts? There's no criminal charge to bring them there.
Yeah, you're talking about the DA's office agreeing not to press charges.
Yes.
not to-
Until after they're sober and clean.
But
Oh,
I don't, so this
Yeah.
is,
oh.
I don't like that. I don't like that at all.
Maybe we'll agree.
And I personally don't see our general saying, yeah, I'm not gonna
I don't
prosecute this
see
guy.
Ray
Because
agreeing to that.
I think that sets the wrong precedent, I'll go ahead and say it. And I was a probation officer for quite some time, you belong in jail first. And then when you get your bearings together, that's just my opinion, and then when you get your bearings together, we'll furlough you out.
So let me counteract that. So Lucy Joe lives down here in Gallatin, and she's a little bit of heroin every once in a while, and she's trying to get off, okay? And she's lost, she don't have insurance, she don't know what to do. This is a way for her to go to a place where she can get the information from professional people that are there, right there, and then get her where Lucy Joe needs to go. Now, all drug users are not felons, or you know
But he's
what I
saying
mean?
there's already criminal charges there before,
No.
that's
Now,
what he's
they're
saying.
making sure there's not any. Number one, there's not any major
How do you
felonies or
do a
anything.
criminal history on someone if you don't have a probability of a crime being committed?
The program is not.
Sorry, I'm not trying to get way off in the weeds,
They're fine.
I'm just trying to
You're mixing apples and
understand.
oranges, so-
Well, no, he said that, I don't understand how the courts are gonna be involved if this person has never, not even been charged with
That
a
would
crime
be
to
a
begin
warm
with.
hands program that would occur at a later date. Right now, I'm just setting the foundation for a clinic person, somebody with the VA, and a peer person. That way I can try to get more funds for us. That is the first step.
And I understand what he's saying, I get it, I really do. But I think that, you know, we can't just look at people that have been arrested or in the system. That's the whole thing that we've always talked about with kids and all that, is to keep them from going into the system.
I agree, but
Ounce of prevention is worth a pound of cure.
right, but I think the way he's talking here though,
So if you're looking, we're gonna go, I wasn't ready for tonight because I did have
You
an
might-
entire PowerPoint presentation.
no, he's saying that the courts are involved, you can't.
So looking at it, you have the three positions, okay? So you have the coordinator or the clinic medical professional that would be
Okay.
in the one-stop shop. Their main priority right now, there's a few components, and one of them is looking at education, okay?
All right, that's prevention.
The number
Okay.
two is looking at hotspots and bringing together a group of people, that's your DA, public defender, EMS, your courts, looking to see where is the drug use in this area, okay?
Okay.
How can we best tackle it and all of that nature, okay? Number three, looking at potentially developing a warm hands policy. That goes back to the Mountain City area of Tennessee where they actually awarded part of their program funds to warm hands, which may or may not occur. Also looking at it, being responsible for our Narcan, which we're gonna have to buy at some point in time for all of our agencies, okay? Also, you're looking at potentially doing a small, I think it's called the 1 Mile to Work program, and I put that in there. The 1 Mile to Work program is done by other nonprofit agencies such as Goodwill, which helps addicts try to find ways to work. So if somebody out here in the audience does not have that program, they can help supplement it or help fundraise. It is to help connect people to their correct avenues. Then you would have the peer. The peer would be the point of contact in the facility. That would be responsible solely for people who are coming in looking for help, number one, addressing the loved one's needs. If there's a warm hands policy or not, or if Medical Regional wants to know certain aspects of what is out there overall, that's what that would come into. And then you would have a part-time person with a VA or focusing on homeless. that area. So you would have those components in that area. That's where we were headed with the state in the one-stop shop. So it would bring together everybody, number one, for Sumner County under one umbrella to have these open discussions. Because right now, those discussions are not happening. Let's just be honest. Those discussions, there's no one coordinating those discussions. Number two, if you should fund this, I can possibly get additional funding if you all voted for me to explore on it. And number three, the biggest part of it for me is you are setting infrastructure down, because once this is gone, the money's gone. Now, I understand more hands policy may be off the table, which is fine, but I'm just asking for a way to at least set aside some funds to put in the infrastructure. Now, if you want to revisit this, because I was not ready for this discussion today, or bring the PowerPoint, I'll gladly discuss it next week, in a few
I say
weeks.
let's revisit, because I am off the rails, and
Yeah.
I've been trying to.
Yeah, I
Yeah.
think you're right. I think we need to revisit it because it is it really is, when you look at it as a whole, it has a lot of components. When you look at the PowerPoint and you look at all the information that was put together, it will help you clear it up. You know, it'll help clear all the questions up.
Yeah, I'd like to see that.
And if there's areas that you do not want in it, then we can put it in there. When you all make a motion for it to be funded, to say, hey, look, we're funding this, this, and this. We do not want this and this to be touched at whatsoever.
Is it possible the courts and all these people can be here next week, or is that muddy up the water?
That will muddy up the water
Okay.
some, because I'm still waiting for Judge Blanton to return my emails.
Okay.
And then also, I would want to sit down with him to get his feelings on it as well. That's why I was not ready for this discussion.
Gotcha.
That's my only concern.
Yeah.
I don't
Yeah, I
want
don't wanna
to
get off in the
I don't want to
courts.
reinvent the wheel. And I know like I think it sounds to me like there is some components that are not happening that would be new. Also, it sounds to me like there are some parts of it that are not new that I don't want to tie up half of this money.
But that money we have to use to get the bigger grant.
If I
It's
do
not guaranteed.
Right, it's not guaranteed, but
Right.
here's the thing, if I do not have infrastructure in place, I cannot go after these bigger
Sure.
prizes. So even if you wanted to do just like the bare bones and say, look, we will do X, Y, and Z for these people, we want these metrics in place,
That's what you mean by infrastructure. It's some
Yeah.
of these grants, you have to have so much in
Right.
time.
I have to
Okay.
be able to support
That-
it.
It's like an in-kind contribution.
Yes.
then. Okay, but that's not what I heard to begin with.
Okay.
Yeah.
So-
Let's revisit it.
I was hearing charges and DAs and courts. and
No.
I was like, that's not the road I want to go down.
Yeah, let's revisit
No,
it.
we're just looking for infrastructure, meaning I need a program that we have in place saying all parties are coming together and we are looking into opioids instead of just saying, I have this committee over here, this committee over here. I have to have a central hub.
Yeah,
Okay.
Are you talking about staffing a facility?
see, that's what I,
You're looking at roughly 2 positions to 2.5.
Or around the clock?
So you're looking for 2 positions, and right now, I don't know. That's the conversation that I was hoping to have with Judge Blanton, as well as Hal, as well as VA, because VA has said they kind of want a part-time position. And so I came back to finance saying, you know, here's some possibilities. They gave me maybe a different possibility to fund a part-time position, but right now, I still have to put those feelers out there. Because, number one, the opioid, just so everybody's aware, one of the things that has hit Tennessee is they're saying we're holding on to the money. And that's why I don't want to hold on to the money. That's why I'm saying let's release 400 and whatever the number is.
yeah.
$401,622.77 at this point in time to the public to get this money out the door to help them. And that's why I'm asking to retain a little bit, which isn't really a little bit, more than half, to actually set the infrastructure in place so we can go after the bigger fish.
Okay, I ask a quick question, sorry.
Yeah.
Just what happens with that 500,000 if other money doesn't come? Can it maintain just with that?
So if the infrastructure is in place, good question by the way. The train of thought is it would be ongoing for 2 to 3 years to see if we can get any funding, number one. Number two, it would, in case certain people who apply for the grant may not use all the funds, they would take on those funds to get the Narcan, put emergency kits across. One of the areas that the health department has stated in one of their meetings that I've had with them is they want Narcans in restaurants besides public buildings. So there could be a potential to do that as well through this, but we don't know. I am just your grant accountant and your grant
Everybody
writer.
should have Narcan in their car.
So let me be
Cars,
clear.
car.
I am just your accountant and your grant writer. If I can get the federal grants, if you all recommend it.
Got it.
But it would be nice to see somebody that can coordinate this across Sumner County for Sumner County residents.
We do have that first, and you want to talk to them,
We do?
if you want to talk to them.
So
So you're asking for us to make a motion to allow you to go forward with your grant application?
I am looking for that one right now, just to gather more information. There is a meeting on March, let me tell you
We have to
exactly.
notify the commission that we're doing that.
March 21st for me to sit in on just to get more information on it. But I can't move forward unless you all say go forth and at least bring back more information.
Okay, I agree. I'd make a motion to do that.
Yes, second.
Okay.
Everybody in
Get the
favor of that?
information, yeah.
Okay. And then as far as the funding, we're gonna release you want approval to go with $400,000 to
Right.
be approved to go out to the applicants?
Right now, I mean, I would like 401,000. However, since there is some discussion going on, my recommendation would be to make the recommendation for full funding of $901,000 with the anticipation of holding back $500,000, and at a later date, should that $500,000 not want to be earmarked, then we would have the discussion of releasing that portion in a second round.
That sounds like a good, that doesn't restrict. Go ahead.
I make a motion that we do that.
Darryl, you said you
Second.
made a motion, second. Everybody, all in favor?
Aye.
May I just have a verbal confirmation for our attorney as what we just voted on, just to be clear for the record?
Everything's going out as long as everybody knows that we may pull 500, fall back 500.
That's what I understood it as.
Okay.
Yeah.
That's what I voted on.
Okay, just to
November
make sure.
10th, right?
Okay, so, and then you're gonna bring back the PowerPoint presentation for the, One Stop
Yes.
program next meeting.
I will do that, and I will also list out for you the grants that we are looking at that Smart Tennessee has recommended us to look at and to go forth on, or at least knock on the doors for additional funding.
We need to make sure, because we made a policy that we have to notify the commission that we're going to be doing that, right, on the grant?
So,
We're
on-
applying in that, what we
I think you can research, but you don't have to you have to notify them before application.
Yes.
So
So he can research.
Are you
well,
researching or are you gonna apply for it?
I am researching, because the application's not due till May 1st, but it says that any grant applied for without going through the prior review process shall be not considered for the county commission, which is what you all have just said. Beforehand, it says, quote, "The Sumner County Board of Commissioners meeting in a regular session on the 23rd of October, 2023 requires the Sumner County grant writer prior to the beginning of the grant application process to present to the appropriate committee all available information for all grants which the grant writer shall begin the process of application in the following month."
So just research it.
I'm just researching.
Research,
Okay.
Do it in April and have it May.
Okay.
Yeah.
Do it. So
So
that,
The way we work, I would get everything ready to hit enter,
Yeah.
just in case there's a snag.
yeah,
Go.
yeah. So, anybody have any questions? And are we ready to finalize our meeting?
Motion to
Second.
Got 2 things for everything.